Hello. Good morning, sir.
Yeah, Vimalji, just 1 minute. We are just putting it live on Facebook.
Okay.
Okay, you can start now. You will be having 1 hour for the session. Thank you.
Okay, sir. Thank you. Okay. So, good morning, one and all present here. Respected Dr. Pratiti Burman, Madam, Dean and Associate Professor from the Faculty of Humanities and Social Science, Assam Downtown University. We have our respected Dean, Dr. Satish Kumar Bodla, sir, with us. He is a Dean and Principal in charge at Faculty of Social Work, Parole University. I also welcome all the faculty members and students here in the webinar on reproductive health and mental health of the women. Now I request our respected Dean, Sir Dr. Satish Kumar, to give a welcome address and introduction of the guest.
Okay, so very good morning to one and all present here. Respected speaker of the day, Dr. Partiti Burman, my esteemed faculty members and coordinator of the webinars and dear participants. It is really a matter of pride and privilege for me to welcome you all in this one-day webinar on the very relevant topic for social work, that is reproductive health and mental health of women. It may be in the field of social work or it may be HR. Everywhere people talks a lot about mental health of various sections of the society. And I think women is one of the very important component because they need to play the dual role at family as well as, professional roles are there. And somewhere, they might be affected by some issues that may affect their mental health. So it is, I think, really a wonderful session planned by our coordinator, Mr. Vimal Makwana. And I hope the whole discussion will be very fruitful and helpful for us to understand the various dimensions associated with the health of women. And we are with us Dr. Patiti Varman, who is a teacher, social worker, and sociologist in the field of humanities and social sciences from Assam Downtown University. And I was lucky I had the opportunity to work with her. Long back, we were together. So I know Madam expertise in the field, so that's why we thought let's invite her. So right now she's working as a dean at the Downtown University, which is situated in Guwahati city, Assam. After completion her study from Nirmala Niketan, she is a product of Nirmala Niketan, the University of Mumbai, and she has worked as a various government and non-government organizations of India. Besides serving as an assistant editor to a scientific journal at Bangkok, she has published 2 books, edited, self-authored, and chapters in others many books, articles in journals, and presented papers at various national or international platforms. She has more than 10 years of experience in the academia as well as industry. So we will welcome you all, ma'am, welcome you in this particular webinar. And thank you very much for sharing your valuable time to our participants. Thank you. Over to you.
Hello.
Thank you, Satish.
Madam, you may continue now your presentation. Over to you.
Okay, thank you, Mr. Vimal. Okay, so today we will be basically discussing about the reproductive health and mental health of women. And when we talk about reproductive health, it's usually we are focusing mainly on women because they are the vulnerable groups. So today's my presentation also, I'll be focusing mainly on women and her experiences in terms of her reproductive health and mental health. So let's try to understand what is reproductive health. So, according to WHO, that's World Health Organization definition, reproductive health is a complete physical, mental, and social well-being, and not merely the absence of disease and infirmity in all matters relating to reproductive system and to its functions and processes. So when we talk about reproductive health, we need to understand that it basically encompasses both all the 3 aspects, that is the physical, mental, and social well-being of a person, where the reproductive systems and other issues related to reproduction are related. So if we look into the reproductive health, it addresses the human sexuality and reproductive processes, functions, and system at all stages of life, and implies that people are able to have a responsible, satisfying, and safe sex life, and that they are have the capability to reproduce and the freedom to decide if, when, and how often to do so. So it's a complete aspect of our sexuality. It talks about the whole reproductive process, and it also gives us the freedom to choose when and how we want to have and how many children we want to have when it comes to the reproductive aspects. Men and women have the right to be informed and have access to safe, effective, affordable, and acceptable methods of their choice for the regulation of fertility, which are not against the law, and the right of access to appropriate healthcare services for safe pregnancy and childbirth, and provide couples with the best chance of having a healthy infant. Okay, so that's the next aspect which reproductive health talks about. And reproductive health is a life-long beginning even before women and men attain sexual maturity and continuing beyond a women's childbearing years. So here another thing which we need to understand when we are talking about reproductive health is that it starts the moment before we attain our sexual maturity. Therefore, we also have services or programs for adolescents' reproductive health, because reproductive health is very, very important aspect of every individual. And for women part, when it comes to women's reproductive health, it has to go beyond reproductive years. And usually in Indian context, when we talk about reproductive years, it is from 15 years to 49 years. But when we are talking about reproductive health, we go beyond those childbearing years, that is from beyond 49 years of age. So when we look into the historical aspect of reproductive health, you need to understand that it started with certain concepts and certain issues and ideas. So in the 1960s, the focus when it comes to reproductive health, it was mainly focused on the population control, especially in the developing countries, because the developed countries felt that the developing countries are producing a lot of children, and it is not regulated, and the population is increasing day by day, and it might create a problem in near future. So in the beginning, that's in 1960s, the focus was on controlling the population. Okay, so reduce fertility through contraceptive pills, IUDs, and hormonal methods were targeting the women's bodies, especially in the developing countries, because the developed countries felt their population is educated, they can have an informed choice there. Because they are educated, they are not having many children. But in developing countries, they felt that women's fertility should be controlled, their bodies should be controlled. And how do you control their fertility, and how do you control the bodies of the women? Through various contraceptive methods, because during that period contraceptive methods came up, contraceptive pills came up, and intrauterine device which can be inserted into the reproductive organ of a woman, and her fertility can be regulated. Then hormonal injections can be given on a periodic basis, so that she doesn't become pregnant due to unwanted or unprotected or unwanted situation where she has sex with her partner. So that was how the developed countries looked into it during the initial phases of reproductive health. Then populations policies became widespread during that period, 1960s and 70s, where developing countries were very much targeted through UN agencies and the variety of organizations in the concept of, so-called safe or planned parenthood. So these are organizations and non-governmental organization, as well as UN bodies also participated during this period to control the fertility of the developing countries, where they felt the population is increasing day by day, and it might create a problem in near future. The dominant paradigm argued that rapid population growth would not only hinder development, but was itself the cause of poverty and underdevelopment. So the basic idea behind the whole concept of this population policy, or in the name of reproductive health, was that to control fertility, because with lot many population, it will hinder the developmental aspect. It is creating poverty in the society. So therefore, control, it's basically governed by the Malthusian ideology, where population might create a problem, or it might become a threat to the whole development of the countries. Okay, so with that concept, the whole reproductive health came into being in the initial period. However, in the 90s, especially in the 1994 International Conference on Population and Development, ICPD, which is known as held in Cairo, brought out few key issues. Like the first was the growing strength of the women's movement and their criticism of overemphasis on the control of female fertility. This conference, or this platform, gave footage to the women rights activists, basically who were fighting for the women's rights, her reproductive rights, and they came up together and they criticized this approach of the developed nations towards the developing countries, where they were trying to control the women bodies and their fertility, where women were targeted, where women were kept or looked into as a commodity, not as a human being or as an individual. So they came up, this Cairo conference brought out a lot of women's organization internationally, where they came up and they demanded that women's body should not be targeted for fertility control. And second aspect which happened was that they demanded that beyond fertility, you need to look. And at that point, AIDS was a pandemic, and they felt that that sexual activity doesn't only talk about reproduction or talk about population control. It also needs to address issues like HIV AIDS, and therefore informed consent and informed sex, and where barrier methods should be used, so that this HIV/AIDS or anything related sexually transmitted diseases should not spread. So this was another concern which happened during this conference. And the third development was that that brought a unity to the others, was the articulation of the concept of reproductive rights and interpretation of international human rights treaties in terms of women's health in general and reproductive health. What happened, if you go in deep, this is a 1 hour presentation, so I haven't gone into deep. So what I have tried to show you the glimpses of the historical development of reproductive health movement. You will see that as I have said in my previous slide, that it was more of controlling the population, controlling the women, who they felt that women are not responsible enough, so they needs to be controlled by the government or some agencies in terms of fertility. But nobody was looking into the reproductive rights. It's as a right, like any human rights. Reproductive rights is another concept which was brought forward during this international conference, and they demanded, these women's groups or women's rights activists demanded that there were a lot of international treaties which were there in place and which talked about reproductive rights, but that was not taken into consideration when they were talking about reproductive health. And they felt that this is the high time that you recognize reproductive rights as human rights, basic human rights of any men, women who are involved with it. Okay, so there was the whole concept of reproductive rights came into being during this period. So what is what is reproductive rights, from reproductive health to reproductive rights? The reproductive rights basically talked about right of the couples and individuals to decide freely and responsibly the number and spacing of children, and to have the information and means to do so. It should not be something that reproductive health, what was happening in reproductive health, there were policies made that in China, what happened, you have only one child policy. In India, the focus was on having two children, not having more than two children, and that was being propagated. And in fact, there was in one moment there was mass sterilization which happened in 1970s 70s. So these things were happening. Some coercive measures were taken up by various governments in the name of population control, in the name of fertility control. So when the concept of reproductive rights came into being, here it talked about that people are capable of taking their own responsibility, especially the couples. They should have the right to decide freely as how many children they want, what the space they want to keep between the children, and should have proper information. The cafeteria approach, what is cafeteria approach? The cafeteria approach is where you have different items kept and you go and choose and you decide which is best for you. You will decide that, okay, this is the best method which I will adopt. It should not happen that government is giving you certain things and forcing on you. And that was happening at that point of time, especially in the 70s, where men were procured to have sterilizations, and there were sterilization scams going on. Even in China, very coercive measures, certain services were not provided to couples who had more than one child. So this approach needed some kind of change, and that is how this reproductive rights thing came into being. Then second is to right to attain the highest standard of sexual and reproductive health. And third one is to right to make decisions free of discrimination, coercion, and violence. As I have said it, there should not be any violence or coercion, because many a times what happened, there were incidences in Indian context where men were procured. Some of them were even not even married. Some of them were adolescent boys who were procured and who were forcefully put into sterilization camps, and they lost their reproductive power forever because they were young as 15-16 years old boys. So these things were violence against their basic human rights. These things were coercion when it comes to their own bodies. So these things were questions at that point of time, and they said it's a right of every individual to make decisions which is free of discrimination, coercion, or violence. Then subsequently, another thing which was being said is the reproductive rights have gone further, so that, for example, they spoke that maternal death, which is one of the very, very important aspects when we talk about reproductive health, especially in the context of India, where we have high rate of maternal mortality and infant mortality. And when it comes to maternal death, it said that it is a social justice as well as a health disadvantages, and placing the obligation on the governments to address the causes of poor maternal health through their political, health, and legal system. And with this advancement of reproductive rights, they also say that it is the role of the government which plays a very, very crucial role when we talk about maternal death. The government should take responsibility of reducing the maternal death, and it is a social obligation, and it is something, the whole political system, whole health system, or legal system of any given country is responsible for the death of a mother while giving birth, or after giving birth. She dies within the 45 days, or within 42 days. It is the government who is responsible, who has not been able to take care of the the mother who has given birth. So it make this whole system made it compulsory for the government to take responsibility for the health of the women. So this is the history of reproductive health and reproductive rights. Now let's try to understand what is mental health. And when we talk about mental health is a term which is used to describe either a level of cognition or emotional well-being or an absence of a mental disorder where we are emotionally well enough, we are emotionally strong enough to carry on our day-to-day daily lives and the task which we are supposed to perform, and there is no mental disorder. That is what mental health talks about. So analysis of mental health indices and data reveals that the patterns of psychiatric disorder and psychological distress among women are different from those seen among men. So why we are discussing, so that's the reason why we are discussing, because when we are talking about reproductive health, we also need to talk about mental health, and the mental health aspect of women is little different from the mental health issues which are experienced by men. Symptoms of depression, anxiety, and unspecified psychological distress are 2 to 3 times more common among women than men, whereas addiction, substance use disorders, and psychopathic personality disorders are more common among men. So you need to understand that certain things are more common among women and certain things are more common among men. So when it comes to anxiety, when it comes to general anxiety disorder, depression, and certain unspecified psychological distress which happens among women, which is 2 to 3 times more than men, you will find less number of men having that kind of issues, whereas men have issues like when it comes to substance abuse, then addictions, then psychopathic personality disorders. These are more common among men. Then why mental health? Mental health as a component of reproductive health has generally been and still is inconspicuous, peripheral, and marginal. If you remember the first definition which I gave on reproductive health, it encompasses both three aspects, not both, three aspects. That's the physical, mental, and social well-being of a person. So if you look into the mental health aspect in the reproductive health services provided by the government, the policies we have in our country are somewhere not being able to address the mental health aspect. The programs which we are having in our country are basically catering to the physical well-being of the women. The attention it received was very, very insignificant compared to the physical part. So there are several possible reasons for the lack of comprehensive database on reproductive mental health. First of all, the obvious lack of integration between mental health and reproductive health may reflect on enduring intellectual habit and mind-body dualism. The study of women bodies and reproductive events have generally been rapidly separated from the study of their minds, including how women might think, feel, and respond to these events and experiences. Secondly, efforts to examine the mental health implications of the reproductive health have focused on relatively small number of sexual and reproductive health conditions. So there are two reasons why it has failed to do so. The first one is that people never thought, or the researchers, the practitioners, or the people who are working in terms of reproductive health, they never felt uh, that we need to look into the way or the way women feel or think or perceive the things when it comes to their bodies. They focus more on the bodies of the women. Then secondly is that the whatever studies were there, very small numbers were studies, and that too related to their certain health conditions, sexual and reproductive health conditions. So that cannot encompasses the other aspects which got neglected in that process. The available evidence on reproductive mental health conditions comes overwhelmingly from the middle and high income countries, conveying the false impression that such conditions do not affect or concern women in low income countries. So whatever data you will find in the internet, in fact, when I was researching for this topic, I couldn't find much of data. The data is the database is very small, and the database which we get mostly coming from developed countries or high income countries, but there is not much of data when it comes to the developing countries like India, Nepal, or Bangladesh. We will not find much of data when it comes to the mental health aspect. In an Indian study, 1 year incidence of attempted suicide was 0.8, and 7 of these women had baseline common mental disorders. One study is which we could find, and this study was saying about depression, anxiety disorder, and these women who attempted suicide, and it was a study on suicide, and the people who committed suicide, and out of these people, out of the whole population, 7 of them of the women, and all the women had some problem or the other, like depression or anxiety disorder, before they committed suicide, which was found. And there was another study by Biswas, where they found that girls from nuclear families and women married at a very young age to be at high risk for attempted suicide and self-harm. So, and when you look into the data available, and you will find, in fact, my own PhD work was on reproductive rights of women, and major finding for my report was that women were married as child brides. So we never looked into, in fact, my research also, I could not look into the mental health aspect of the women, which was only confined it to the rights as a part, not into the feeling part or the experiences part, except my case studies where I could write certain certain experiences of women, what they have gone through after giving birth, or after losing their child, or after their abortions. It was found that that it's women who are married off at a young age has a higher risk or higher tendency of going committing suicide or self-harm. And it was also it was also being found by another study which was carried out by Bishwas et al. Then the symptoms such as irritability, restlessness, anxiety, tension, migraine, sleep disturbances, sadness, and lack of concentration occur more frequently during the premenstrual and menstrual phase among women. This is another aspect which is very common, which you will find also, that women do complain about all these issues, which we share among with our friends and with our doctors also sometimes. But my experiences so far is that it is people do not give much importance to this. They said, oh, okay, you're fine, it's all right, it's part of your PMS or premenstrual cycle where you find all these things. But there is no help provided for this kind of issues or problems which women go through. Then mental disturbances frequently occur during late pregnancy and in the postpartum period. Postpartum blues is the most common and least severe postpartum illness, affecting between 50 to 80% of new mothers. That is another aspect that which is again very much neglected, and this is where nobody talks about also. Even the doctors also never tell you and they will never let you know that you might go through this unless and until the doctor is very sensitive, the caregiver is very sensitive. Otherwise nobody tells it. And most cases it is majority of women, it's from 50% to 80% of women suffer from this, where they go through a phase of depression which is known as the postpartum depression. It can be at times very severe, it can be mild, and it can be sometimes even life threatening also. And this is where somewhere the people fail to extend the help that women needs at that point of time, and they need real treatment at this point of time, where they need to see their doctors, psychiatrists, counselors, take medicines if needed. And this is where the government policies have also failed. There is no scope of looking after these aspects in Indian context, and the services or the policies do not talk about it. In addition, the postpartum period carries the potential for aggravation of psychiatric symptoms in women with pre-existing mental illness. In case if a woman is already having some kind of pre-existing mental illness, and with postpartum depression, there is a chance of it is getting aggravated and having severe consequences of it. Then pressures are created by the multiple roles and unremitting responsibility of caring of others is another burden which as a woman everyone faces, caregivers. You are not only a caregiver to your child, you are also a caregiver to your in-laws, you are a caregiver to your husband, you are a caregiver to the people who are in need, and it doesn't bring any accolades to you. So that silent role women plays, that also has a major role into the psychology of the women or the mental health of the women, where there is no recognition, there is no appreciation, and it plays a havoc in the health of the women, especially the both physical and mental. Because as you all of you know that we play a dual role, and in that role I don't think it's a dual role, I think it's multiple roles which we feel which we play, and in those multiple roles nothing comes back to you, or no recognition comes to you, because it is something unpaid, and therefore the recognition is not there. In addition, gender-specific risk factors such as gender discrimination and associated factors of poverty, hunger, malnutrition, overwork, domestic violence, and sexual abuse combine to account for women's poor mental health. So again, these are the other things which has has a role to play when it comes to the mental health aspect of women, especially the poor women who are struggling with poverty, hunger, where they do not get to eat proper meals, then they are they are suffering from malnutrition. Top of it, you have a lot of work where you are overworked. Then if you are facing domestic violence or sexual abuse from your intimate partners, that has a very, very adverse effect on the mental health of the women. Then if we look into the male-female ratio for the allotment of beds in government mental hospitals, where you will see that 73% beds are allotted to men and 27 are allotted to women, whereas for other services, for example, researchers, and for even for physical health, and where research is also being involved, there again you will see the bed allotment is more in terms of even women also, though it is more for men, but comparatively when it comes to mental health part, physical health is doing better, where the ratio is 66% for men and 34% for women. But when it comes to mental health, it is 73 for men and 27% for women. So that's how the mental health aspect is getting what shall I say, getting recognized or getting or importance, not getting importance even in the government level. So when it comes to reproductive and sexual ill health, it is estimated to account for 20% of global burden of ill health in case of women and 14% for men. However, this does not cover the complete or full burden of ill health of men and women, but it's a small section of it is being getting represented in this statistics. Mental and physical health are closely linked, influencing each other in powerful and complex ways. Where one needs to understand whatever you are facing physically, it has an impact on your mental health. If there is constant pain in your body, there is constant ache in your body, if you are having some health issues, then it will automatically make you irritated, it will automatically make you feel sad, it will automatically make you slow down in your responses towards other things. So therefore there's a close relationship how you are feeling, how your physical health is responding. So this things needs to be taken into account, and there is a complex relationship between these two. And therefore any definition of health or reproductive health, you will see it talks about both physical, mental, as well as social, where the environment is involved with. According to WHO 2001, depression is the single largest contributors to the years lived with disability in adults. So where depression is something, even for psychiatrists, they do not think depression is something to ponder upon. For them it is like common cough and cold, because they feel there are severe mental health issues than depression. But it can be quite a disability for someone who is suffering from disability. And it is one of the major contributors when it comes to disability among the adults, according to the WHO. So depression is related to your mental health. Symptoms of depression and anxiety, as well as unspecified psychiatric disorder and psychological distress, are 2-3 times more prevalent among women than men, as I have mentioned it earlier also. And you need to keep this in mind, that when we are talking about this depression, here we are talking about larger section, which is women. Then I want to bring it to your notice certain key points which are being pointed out in terms of the reproductive health services in Indian context. If you see this statistics, you will see that this statistics nowhere it's being mentioned anything about related to mental health aspect. Here they have given that 49 million women in India have an unmet need for contraceptions. They are saying that about 49 million women do not get to have proper access to the contraceptive methods which are available in the market. Then 51% of women giving birth make fewer than 4 antenatal care visits. In India, you have to, it is free that every expectant mother should have 4 antenatal checkups, and the statistics shows that more than half of the women who are expecting are not getting this full coverage when it comes to antenatal checkup. That is, before giving birth to her child, she needs to have these checkups regularly carried out by the government doctors or the nurses. If not government, even in the private sector also, they need to have this access. So, and the next one is the 40% of women do not receive a postnatal care checkup within 24 hours of delivery, because this 40% of women maybe have given birth at home or with the help of some trained personnel they have given birth, but within 24 hours they should be there should be some health professional, trained health professional, who gives a checkup to these women. But this is not happening in Indian context. Women, 40% of women are not getting that. And 14 million women do not receive needed treatment for one of the four major curable STIs or sexually transmitted infections. Okay. So quite a large number of women do not get any checkup for that STIs or sexually transmitted infections, which can be curable. So if you look at this data, you will see nowhere nothing has been mentioned about the mental health aspect of the women, because none of our policies are talking about it or looking after it. So what are the concerns? It is essential to recognize how socio-cultural, economic, legal, infrastructural, and environmental factors that affect women's mental health and mental health configured in the given community settings. So it is very important how we look into the socio-cultural aspect of women and her economic background, her access to legal services, then the infrastructure she is in, then the environment she is living in. All these things are very, very important when it comes to women's health, both physical and mental health. Because if you're as all of us are aware that our health is a reflection of the society we live in, the food we take, the kind of relationships we share, the kind of access we have to the healthcare facilities, the kind of food we are eating, all this overall has an impact on our health and well-being. So therefore this is something very, very important, that when we are looking into women's reproductive health, we need to look into all the aspects which has a role to play in her mental health as well. Then gender-based violence, specifically domestic violence. Within these areas, a number of concerns were raised, including access to safe abortions in the context of the threat of violence towards women seeking a termination of pregnancy, impairment of sexual health as a result of violence and abuse, and lack of control over contraceptive choice, and the prevention of sexually transmissible infections, including HIV/AIDS. So that is another very, very important concern or important issue which we need to keep it in mind, is the gender-based violence. Here I have not mentioned another gender-based violence which is very much part of our social culture thing, is the sex selective abortions, which happens where on the basis of it is illegal, it is a punishable offense, but still it is happening in and around us. And therefore we have the whole concept where Amartya Sen has spoken about missing women syndrome. So we have a tradition where earlier it used to be female infanticide, now it is female foeticide, which is happening. And that is another violence which is happening against women. Secondly is the intimate partners violence, which is happening towards women. In fact, one of the National Family Health surveys where the finding was that majority of women in Indian context face intimate partners violence, and most of them feel it is normal, that it is all right to be beaten up by your husband or your intimate partner because of the mistakes you have done. And in that process, what happens, this process can lead to unwanted pregnancies because unprotected sex can happen. Then not allowing the partner to access the contraceptives, then not allowing the partner to go for abortions in case the woman does not want to carry on with the child. And sometimes it might lead to even having infections, sexually transmitted infections. HIV/AIDS as well. And this is happening to women quite often, and this is happening within the four walls, so which is very, very intimate, which is very personal. So women are not having any access to talk about all these things or go for any kind of help. So these are certain concerns when we are talking about reproductive health and mental health, because violence can have, or intimate partners violence can, or coerced sex or forceful sex can have a long-term effect on the women, and this might later on manifest as you know post-traumatic stress disorder. So these things are main concerns when we are talking about reproductive health and mental health of women. I would like to conclude that the mental health and emotional needs of women are seen as being outside the scope of reproductive health services, which I have been talking throughout my presentation, because it is something not looked as something very serious, or they feel it doesn't need to be talked about, which consequently provide no support or assistance in this regard. Even in safe motherhood initiatives, safety is narrowly defined as physical safety, the safety of the mother's health and the newborn child's health. And the links between safe reproductive healthcare practices, treatments, or services and the mental health of mothers are rarely considered. Mental health often appears to be considered as unaffordable luxury for women in resource poor settings, especially countries like India or any developing country, where they feel it is a luxury to talk about all mental health issues. The primary care providers must be aware of the major mental health problems affecting women, routinely inquire about common mental health problems, provide the most appropriate interventions and support, and provide education to the community on issues related to mental health of women. As a social worker, I feel when these ASHA workers or the nurses or the doctors, when they are talking to these women, they need to inquire besides their physical well-being. They need to inquire beyond this, the physical aspect, and find out the reasons. And in the community level, the ASHA workers can really create awareness with the help of the organizations, if there is any organization working in the community level. Then government policy of safe motherhood should include the mental health aspect as soon as possible, because nowhere in those policies you will see that they are providing any support in that matter. Then there is adolescent reproductive sexual health strategy, which was launched in 2005, and again in 2014 it became National Adolescent Health Program, or Rashtriya Kishore Swasthya Karyakram. And they also need to address the mental health of adolescents as well, because in future these adolescents are going to be the adults, people who should have some understanding, or who should know the mental health issues and problems one can have, and how to have a balanced life, life which is where emotionally they are strong enough to take up the challenges in life. So these are the things which I feel we need to talk about more often. And there are many studies, 100, and you will find a lot of studies which has happened when it comes to the reproductive health of women, but very fewer studies have been carried out when it comes to the mental health aspect. So this is the high time that we address it, because it is a lifelong situation, especially for women. They need this support when it comes to their mental health aspect, from adolescent to their post childbearing years, even during or before menopause also they need it very much, because the kind of changes they go through, the hormonal changes that happens to their bodies, only women can experience, and they can only tell you how difficult it can be at times, both physically and mentally. With this, I conclude my presentation. Thank you.
Thank you, madam. Now I ask students, if you have any query, you may message me personally, or you can also ask in the chat box.
Directly
have
they may
any
ask
query,
if time,
please.
Vimal, if time permit, that directly they may ask. Possible? Is it possible
Yes,
to ask
yes.
directly?
No, not possible. They have to
Okay,
write it
okay,
down in a
okay,
question answer
okay, okay,
section.
okay. Please.
Yes, students, if you have any query, please type it in a chat box or question answer session. I may also request teachers, if you have any query, please ask.
Yes, please. If you have any doubt, any query, you may ask right now.
Hello, madam.
Yes, tell me.
Yes, one of our student, Mr. Sujit, has asked a question that when first child is having cerebral palsy, okay, and still family is facing giving pressure to women to have a second child, so there is a possibility to have a normal child, or what are the problems may arise during the pregnancy or delivery?
First of all, it's a question for the doctors. I'm not a doctor, but
Yes, yes.
what I could say from my experiences is that it's always better to have a discussion with their gynecologist, because if your first child is having some kind of disability or what issues, then they are the best people to guide you whether to go ahead with your second pregnancy or second child or not. And there are many uh, tests can be done before the birth of the child to see if there is any problems related to the child. So as a student social worker, what you can suggest to the mother is to always consult her gynecologist or the general physician also. They can also guide her, because taking care of a child with cerebral palsy can be a daunting task for the mother, to look after that child, to care for that child. And usually it always comes to the mother when there is a child with disability. Very rarely the father or the other people take care of them. So it is the mother's role. So my suggestion will be that they should consult a doctor rather than taking decisions on their own, because the
Okay.
doctors can really guide them well.
Thank you, madam. Now, second question is from my one of the colleague, Miss Neha Dubey. She has asked that these days people are having fertility problems. So how come the population is increasing?
Population is not, it's again depends, the if you look at the, when I talked about population control, I talked in terms of the historical development of reproductive health, where at that point of time people felt that the fertility of the developing countries should be taken care of. And when it comes to the infertility aspect or fertility problem, where people are finding it difficulty to conceive, this is a modern day phenomenon which has happened, and it's an experience or the phenomena which is happening throughout the world due to the kind of stressful life people are living. So there is no connection of that way we can say that infertility, and this infertility is happening with the people who are economically well off. Very rarely you will find socioeconomically disadvantaged population having that problem of infertility, because there are other reasons which is associated with it. So I do not see there is any connection between infertility and population, because the population who is experiencing infertility are a group of very small population, not the majority population. That is my understanding so far. I don't know whether I have answered your question or not, but that is what I have understood.
Thank you, madam. Any other questions, students, teachers? Okay, madam. So I think there is no question. So I would like to conclude the session. So I would like to express my deepest gratitude to you. Thank you for giving us a very knowledgeable and valuable time to us. And you have shared very informative informations to our students and to our teachers, which is going to helpful to them for their research work and in their study as well. And it may also helpful them to implement when they are doing some field work or when they are doing their career. So once again, thank you from bottom of my heart, from on behalf of Faculty of Social Work, Parul University Management, our Dean, Dr. Satish Kumar, and all the students. Thank you, madam.
Thank you, Mr. Vimal, for having me. Thank you so much.
Thank you.
Have a good day. Bye.
Same to you, madam. Okay, bye.